Hello, today I'm going to presenting on respiratory infections presented by Aparna Shachi. Respiratory infections are caused by bacteria or viruses transmitted through airborne droplets, sneezing, coughing, talking. Most diseases spread through contact or close proximity because the causative bacteria or viruses are airborne. They can be expelled from the nose and mouth of the infected person and inhaled by anyone in the vicinity. Let's talk about the overview of common respiratory infections. First one is chickenpox. Chickenpox is highly communicable disease caused by the varicella virus, a member of the herpes virus family. In temperate climates, chickenpox occur most frequently in winter and early spring. Chickenpox is transmitted to others by direct person-to-person contact, by droplet or airborne spread of discharge from an infected person's nose and throat, or directly by contact with articles freshly soiled. Now let's talk about the symptoms of chickenpox, which include initial symptoms include sudden onset of slight fever and feeling tired and weak. They are soon followed by an itchy blister-like rash. The blisters eventually dry, crust over, and form scabs. The blisters tend to be more common on covered than or on exposed parts of the body. They may appear on the scalp, armpits, trunk, and even on the eyelids and in the mouth. Mild or unapparent infections occasionally occur in children. The disease is usually more serious in adults than in children. How soon do symptoms appear? Symptoms commonly appear 15 to 16 days after exposure to someone with chickenpox. How to prevent chickenpox? The best method to prevent further spread of chickenpox is for people infected with the disease is to remain home and avoid exposing others who are susceptible. If they develop symptoms, they should remain home until 1 week after the skin eruption began or until the lesions become dry and crusted. Pay particular attention to avoiding unnecessary exposure of non-immune newborns and immunocompromised people to chickenpox. Next one is measles. Measles is a highly infectious disease of childhood caused by a specific virus of the group myxoviruses. It is clinically characterized by fever and other symptoms of the upper respiratory tract followed by a typical rash. Now let's talk about what are the symptoms of measles, which include a high temperature, sore eyes, runny nose usually occur first. A small white spot usually develop inside the mouth a day or so later. They can persist for several days. A harsh dry cough is usual. Going off food, tiredness and itches and pains are usual. What are the treatments for measles? There is no specific medicine that kills the measles virus. The treatment aims to ease symptoms until the body immune system clears the infection. For most cases, rest and simple measures to reduce a fever are all that are needed for a fully recovery. Symptoms will usually disappear within 7 to 10 days. Next respiratory infections is mumps. It is an acute viral disease characterized by fever, swelling, and tenderness of one or more of the salivary glands, including the parotid gland located just below the front of the ear. Mumps is transmitted by directly contact with saliva and discharge from the nose and the throat of infected individuals. The symptoms include fever, headache, muscles itches, tiredness, appetite, loss of swelling of parotid gland, complications. Mumps is contagious 3 days prior to and 9 days after the onset of symptoms. The mumps vaccine, which is contained in the MMR, measles, mumps, and rubella vaccine, can prevent this. Next one is diphtheria. Diphtheria is most common where people live in crowded conditions. Unimmunized children under 15 years of age are likely to contract diphtheria. The disease is often found among adults whose immunization was neglected and is more severe in unimmunized or inadequately immunized individuals. What are the symptoms of diphtheria? There are two types of diphtheria. One type involves the nose and throat, and the other involves the skin. Symptoms include sore throat, low-grade fever, and enlarged lymph nodes located in the neck. Skin lesions may be painful, swollen, and rendered. When it comes to the treatment, certain antibiotics such as penicillin and erythromycin can be prescribed for the treatment of diphtheria. A diphtheria antitoxin is also used for treatment. Next one is tuberculosis. Tuberculosis is often called TB for short. It is a serious but treatable infection caused by the bacterium Mycobacterium tuberculosis. It is primarily an illness of the lungs, but it can infect any part of the body. Where TB is in lungs, it is called pulmonary TB. TB can also infect other parts of the body such as brain or spine. This is referred to as non-pulmonary TB. A person with TB can die if they do not get better treatment. The following are the symptoms such as a cough that lasts for more than 2 to 3 weeks, coughing up blood or sputum, weakness or extreme tiredness, loss of appetite, weight loss, night sweats, and fever, also pain in the chest. One of the most important risk factors for contracting TB is spending sufficient time with someone who has an infectious form of the illness. It may take up to 8 hours or more of exposure for sufficient number of the bacteria to build up in the body. Other risk factors include HIV, living in a country or city where TB is common. TB in the UK is more common in the bigger cities. When it comes to the conclusion, respiratory infections remain a global public health issue. Prevention through vaccination, hygiene, and awareness is crucial. Early detection and appropriate treatment reduce complication and mortality. Thank you.